A big hi to all the viewers. I am Dr. Hardik Thakker, an MD physician practicing in Mumbai. I would like to take this opportunity to talk to you about coronary artery disease. As the word suggests, coronary artery disease is a lifestyle disorder which affects the blood vessels of the heart. So what happens in here is there are these cholesterol thrombi, blocks as we call them in layman's term, which deposit in the arteries and then they cause blockage to your microcirculation in the heart. So because of this, what happens is the patient complains of pain in the chest, breathlessness, leg swelling, and sometimes even palpitations. And a lot of diabetic patients may just get asymptomatic MIs, which is these blocks will be there but they may not have any symptoms that I mentioned before. Now this disease is dreadful because a lot of times these episodes come suddenly in the middle of the night and you may not have even enough time to respond. And a lot of these patients, if they have a very significant amount of block, like say more than 90 or maybe 100% block, they may even die within hours of reaching the hospital. This is the gravity of the situation, and hence one has to act very fast if at all you get a chest pain. But to begin with, since we are talking about lifestyle modification, we want to know what is it in the lifestyle which leads to the coronary artery disease. So as we all know, a lot of people from the urban areas who are having a sedentary lifestyle, they are not eating right, they are not sleeping right, and they are not being even working out. So all this puts a huge oxidant stress, and the wrong diet along with high fat diet, it leads to this cholesterol deposition and the plaques in the coronary arteries. So what should be done? I mean, we need to start at a young age, because it is not as though you need to wait till 40 and then you will start acting, because these plaques start developing as early as 15 years of age. So to begin with, to prevent coronary artery disease, you have to start early, eat healthy right from your young age, work out regularly, have an active lifestyle, and avoid smoking and alcohol. Smoking is one of the major confounding factors, and it predisposes to a lot of damage to the endothelium of your arteries. So leading a good lifestyle right from the beginning is very important to take care of your coronary artery disease. And diabetics, as a matter of fact, are at a very high risk of having coronary artery disease as compared to the general population. And I would also recommend the public, the regular people, at least above 40 years, to have a stress test done once every year along with your lipid profile and sugar. This is just to make sure you are on the right track and you are not missing out on coronary artery disease. I would like to talk a little bit in brief about the stress test, which is a test which is used to diagnose angina. So what we do is we make the patient run on the treadmill for 10 minutes and then we record the ECGs all through the 10 minutes along with the BP changes. And if at all the person has a hidden heart disease which is not reflected on his symptoms, we pick it up, and then this is followed by the angiography. Once the angiography is done, depending on the amount of blocks that are found, we treat the patient either medically or with stents or by bypass. So this is dictated by the number of arteries, the location of the plaque, and the extent of the block. So that's about it for coronary artery disease at the moment. If you wish to have more private consultation with me, you can reach me through my website, which is www.drhardiktakkar.com, and also through the Lybrate website, which is www.lybrate.com. Thank you very much for your time.